For many patients, coming to dental clinic is stressful and nerve-wracking. So dentists, in addition to having the good clinical sets, they also need to know how to talk to patients, how to listen to patients, to build trust and also empower our patients to take part in their oral health journey.
You really need to understand the patient really well, understand their needs, and listen to them properly, and empower them and have empathy. If you want to use some of those skills and improve them, you need to work with a standardized patient.
So standardized patients are the ones we are training them to pretend they are patients. The challenges of the standardized patient approach is time-consuming, it's expensive, it is one-on-one setting, so we have a limited spots for our trainees to improve their clinical and communication skills. Here at the Eastman Institute for Oral Health, our faculty and researchers, so Dr. Xia Cui, she worked with our computer science expert, they actually jumped into this field.
Dr. Cui heard about us from some other collaborators that we worked with, and she reached out to us for collaboration because they were exploring standardized patient-based training, but their funding wasn't sufficient for that, and they were exploring other alternative and came across Sophie.
Sophie is a virtual platform consisting of a 3D character who can see you, listen to you, and respond to you in real time, and can play the role of a virtual patient. So imagine if you're a doctor and you need to practice some fundamentals of what treatment is all about, how to treat your patient, how to listen well, how to have empathy, how to empower them. It's really hard to practice some of the skills, but imagine you could do that now using a tool called Sophie that lives on your browser. I think if you have unlimited resources, I would certainly champion to have humans play the role of a virtual patient to train the doctors. Perhaps you can use AI that exists on your browser, available anytime, anywhere, that you can customize. It's less threatening, it doesn't put you on the spot. It's standardized, it's repeatable, it's objective. I think that kind of tool can really be useful for people who want it. Also, if you think about the diversity of healthcare, there are a lot of people who may come from different parts of the world and they're integrating, and they often want to understand the cultural differences, the language, and other things. So having a tool for them to understand that really quick and add that into their practice, it's really valuable.
So most of the residents who come here in the Eastman are internationals, are coming from different countries, so they have been exposed to different kind of patients in their countries. New York has one of the most diverse group of population, and especially at Eastman, the Sophie helps us understand on how to communicate better with those patients, like in terms of communicating what problems they are facing. And they are here only for a short period of time. So if we don't communicate better in that period of time, we lose the connection with the patient and we lose the faith.
I never imagined dental communication being so complicated, or so many patients having stress and anxiety for a dental care appointment, and it's up to the clinicians to handle that and soothe them and make them comfortable enough for the procedures.
So we structured the feedback of Sophie into 3 different components. We call it the 3 E's: empower, empathy, and explicit. So Sophie can give feedback on all those different things.
So here at the University of Rochester, we are one university. So it's great that we can just go across the street to find our expert in computer science. Our experiences, team science put us together, and we are able to tackle these challenges in oral health education. So the results of this pilot have been published on Journal of Dental Education. So now for the next step, we are taking what we have learned to put into the expansion of training our dental residents. And ultimately, we would like to have Sophie to become a national model to train dentists in communication. Because great dentistry is not only about fixing teeth, but also caring for our patients.